The United Kingdom might ease the restrictions that have been imposed to halt the spread of the coronavirus at different rates in different parts of the United Kingdom. That's according to Prime Minister Boris Johnson's spokesperson. Restrictions could be altered in individual towns and villages if there are indications of a local flare-up of the disease. The limited relaxation of lockdown restrictions introduced on Wednesday allows more outdoor exercise and some social contact applied to the whole of England, whilst the devolved nations stuck with the earlier stay-home message. Any further changes would also be a matter for England, Scotland, Northern Ireland and Wales to determine individually. For more on this, we're now joined by Economist Guy Shone, who joins us via Skype from London. Guy, thanks very much indeed for joining us. Welcome to the programme. What is the situation in the United Kingdom? Are things getting better?
Well, Peter, there's a huge amount of disagreement in the UK, both in terms of the effectiveness of the government's measures, but also on that very question as to whether things really are improving. Boris Johnson's plan has shifted from forcing everyone to stay at home to the latest guidance, which asks people to simply stay alert. And many of Mr. Johnson's critics are saying, well, that message is just far too ambiguous because many of the rules within that are open to interpretation. So, for example, the government says work from home if you can, stay 2 meters apart if at all possible. And of course, the UK is a sort of strange mix of 4 different nations, and we're seeing differences too across those different nations in the UK. So in Scotland, for example, they're sticking to the previous message, which is still stay at home. So it now means, if you live in the north of England, in a town like Berwick, for example, you can go out, sunbathe, go and visit a member of, somebody who's not in your household. But just 3 miles away in Scotland, you're not allowed to do that. So lots of differences of rules, but also differences of opinion on the performance of this government.
Is there a lot of movement between these nations? Let's say I am in Northern England. Can I drive quickly to Scotland? Is there anyone stopping that? Because if you're having different approaches, then it would also have to include the movement of people.
I mean, this is part of the policy nightmare that governments get when they're forced to make a very set of, complex and difficult draconian rules and sort of dream them up in, ridiculously short timeframes. So we are having lots of questions and challenge to the government where all of these scenarios are being brought up. For example, there's now an issue and a debate going on about could you have one of your members of your family work as a cleaner if you were to employ them and they were to come into your house? Or, what's going to happen if you do drive over the border? Will the police arrest you? So there are still policy questions. And as you say, there are still also questions about to what extent will the police enforce any of this? There are fines available. People have been fined for breaking rules, but there isn't a particularly strict approach to enforcement at the moment.
What is the challenge that Boris Johnson is facing? Because, on the one hand, he's got to try and resuscitate the economy. He's a prime minister who gets measured on things like that. But on the other, there is this health scare. And is it finding the balance between the two, or should it just be about the health of the nation and, the economy we'll discuss later?
Yeah, that's the dilemma. That's the challenge, the balance that so many countries are wrestling with at the moment. We've now had 5 days in England where many people working in industries like construction and food production, manufacturing, they've gone back to work. And unfortunately, some data out this morning shows that all-important R rate, that infection rate, does appear to have gone up. Worryingly close to that critical level of 1, which is where the virus starts spreading more vociferously. So, we don't know for sure that the two are connected, but it's certainly given some fuel to Boris Johnson's critics who say that he isn't getting that balance right, that he's far too keen to get the economy moving, and he's doing so at the expense of people's health.
So what conversations are happening with the other home nations, Wales, Scotland and Northern Ireland?
Well, there are a number of committees that where government officials work together. That's always been the case, and to some degree, you have to try and extrapolate the sort of political game playing, the jostling for power, the approach where you try and slightly undermine the other nation but don't look like you're doing it. You know, all of those political games are going on. But actually, aside from that, the scientists, the healthcare professionals, the public health officials are all working together reasonably efficiently. But of course, the other side to this, you know, Boris Johnson and others have been criticised for trying to get people back to work too quickly. The other side, of course, is like so many other nations, hundreds of billions of pounds have been laid out in various forms of support, small loans to small businesses, grants to make sure that large businesses can continue to pay employees. So an awful lot of money has been paid out to try and keep the economy going. Now, obviously, at some point, the difficult task comes of trying to claw some of that money back.
Just how bad has the economy been since COVID-19 touched the UK? Give us a sense of, I don't know, how the GDP has shrunk or the economy has shrunk, just so that we get a sense of just, you know, the impact that it's had.
I mean, Peter, this is where we almost run out of dramatic descriptions. I mean, if you just look at March alone, then GDP in the UK shrunk by 5.8%. I mean, it is very, very clear that the UK is on course for a recession. Now, you also need to put that in context of looking at the terrible situation that other countries are in too. Over in France, just a few miles away, their GDP for the first quarter shrank by an almost exactly the same amount, about 5.8, 5.9%. Germany has now slipped into recession. They've been having terrible trouble even before the COVID crisis with their auto manufacturing industry. So wherever you look, unfortunately, across the UK, across wider Europe, there aren't too many positive stories about the economy.
All right, so ordinary citizens, those are forced to go back to work, I'm sure are doing it in fear. I remember trying to get into work in the morning on the London Underground, and I can't see how you can do social distancing in those tunnels.
This is one of those situations where there just isn't a neat answer. It's very, very difficult. You know, we've seen pictures across social media of people seemingly on tubes commuting in situations that are, you know, clearly not the guidelines of the 2 meters. But then you sort of say to people, if you're working on a huge construction project somewhere, how viable is it to have 10 hours a day working on all sorts of different difficult jobs to maintain that 2 meters, you know, for weeks and months ahead? Very, very difficult to do. So there's just one of the examples of where perhaps policy just can't meet reality. The situation is too difficult to be solved with 1 or 2 just simple rules.
But is there a slowing down at least in new infection rates?
Well, there had been. As I said, the data this morning, it seems to suggest that the R rate has crept up a little bit. It does still appear to be under that critical level of 1, which is the sort of parameter that all the health officials are looking at. But we're going to have to look at it over the next few weeks, because if it is the case that the relaxation has caused to some degree this slight increase, then that is going to make the job of politicians, of business leaders over the next few months all the harder.
All right. You know, we're seeing in parts of North America the politicization of COVID-19. I wonder if it's playing out in the UK in any way. You think about countries like Scotland, who have been talking about secession and so on and so forth. Are these conversations coming up more and more, especially when you have a difference in approach to how to deal with COVID-19?
I mean, Peter, if you're being generous, you could say that you can't expect politicians not to take the chance to be political. And there has certainly been evidence of that. The different home nations, in certain things they say, seem to be trying to make a point of offering a point of difference to one another, while strenuously denying that that's what they're doing. And we've seen all sorts of sort of political tensions and attempts to sort of slightly undermine one another. But it is, a situation that's incredibly tense, incredibly difficult. And of course, there always have been differences on how to handle things across the UK. There is evidence too, which a lot of activity on social media, where people are almost viewing this as a sort of seize the moment opportunity. There are people who have always felt that the way that we do business in the UK, the way that our society is structured, is inherently unfair. They're very concerned about inequalities. And there are some people who are now saying, let's not go back to normal because normal wasn't working. Right. Equally, there are others on the other side of the political spectrum who are saying, goodness, we need to almost free business more than ever before, have smaller government, less restrictions, because if we don't, the economy is just never going to get back to health again. So we're seeing this polarization, two ideologies, both suggesting that now is the time to shift one way or the other.
And of course, there's always vulnerable groups of people. And, one reads about the deaths in care homes. Tell us a little bit about that and what are the authorities trying to do about it?
Yeah, that, of course, has been something that the UK government has been heavily criticised for not getting on top of earlier. Now, we could say that there's a sort of a logic and an obviousness about the fact that care homes containing very elderly people, of course, are likely to be areas where people are more at risk just by virtue of the fact of the people that live within them. But the government has been criticised that they were slow to act in terms of providing equipment to care homes, slow to really provide the financial help that care homes need. Care homes, because they are more sort of multifarious, they're organised in much more of a widely dispersed way. It's obviously harder to simply just provide money and support and keep tabs on what's going on because, it's just a difficult thing to do. But nevertheless, the government have been criticised for not getting on top of that really important part of the healthcare sector quickly enough.
All right, so perhaps in conclusion, the main thrust of this conversation, the step-by-step easing of the lockdown and restrictions. So clarity is what's required, but it doesn't seem as if uniformity across the United Kingdom is there, and this could pose a challenge.
Yeah, and business now are being told to get ready, get back to work. Let's get the economy moving again. All of these sort of snappy political encouragements that they're getting, which is great. And, many people are really keen to get back to running their business again and making money and generating wealth again. That's all fine. The problem, though, is how does that work in practical detail? And that's one criticism that the Prime Minister has had. We've now got a very detailed leader of the opposition, an ex-lawyer who likes detail. The Prime Minister often is criticised for not liking detail. And we're now seeing businesses saying, look, we're really keen to get back to work, but you have to provide guidance to us and support to help, for example, us run a working site, a building site with 3,000 employees all doing manual labour. How on earth do we keep those people 2 meters apart for 10 hours a day, 5 days a week? So it's that practical detail that business is looking for now, really more than ever.
All right. Guy, Shone, thanks so much indeed for joining us and sharing your insights with us about the situation in the UK. Thanks so much. All right, so that's Guy Shone, who's a journalist and economist, speaking to us from the United Kingdom, one of the countries in Europe, of course, that was hard hit by the COVID-19 coronavirus. But Russia has taken over now as one of the problem countries now in terms of the virus.